name is Kelsey Castillo. I'm going to be your student nurse for today. Can I have your name and date of birth? Okay, do you have any allergies, Mr. Slade? No allergies? Okay, let me just go ahead and verify that information with your bracelet. Okay, do you know where you're at, Mr. Slade? Yes, the hospital. Do you know the time? And what's the reason for your visit? Nausea, vomiting, and diarrhea? Okay, so I'm gonna go ahead and start by checking your vital signs. So I'm gonna go ahead and put on my gloves and take a look. Okay, so I'm gonna be checking the patient's appearance, facial expression, their posture as I'm assessing them. So first I'm gonna take their blood pressure. I'm gonna sanitize the stethoscope. Blood pressure is 182/104. Now I'm gonna get the patient's heart rate.
I want 20 more. No, because I said 160 of it. I was trying to blood pressure. For the big
And for the reservations.
I got 28.
20?
Well, 28, first one 26. I'll fix it.
Yeah.
Okay, heart rate is 94. And respiratory rate.
Oh, you know why? I had a 0.6. I had a 0.5.
Oh, okay.
That's what it was serious. Is there a plan?
No.
Okay, respiratory rate is 28. Okay, so you said the reason for your visit was because you were having nausea, vomiting, diarrhea, correct? Okay, so that might cause dehydration, so I'm gonna assess your skin. I'm just gonna go ahead and check for any lesions on your skin as I'm assessing you. I'm gonna be checking using A, B, C, D, E. A for asymmetry, B for borders, C for color, D for diameter, and E for evolution. I'm gonna go ahead and check your temperature with the back of my hands. I'm gonna do your arms. Is it okay if I uncover your legs just so I can check the temperature? Yeah. Okay, great. Okay, so temperature is equal.
You sure?
Now that I have checked your temperature, I'm gonna go ahead and check for your skin trigger. That's gonna help me see if you are dehydrated, and that's gonna be below the clavicle. Okay, so I checked the skin trigger for dehydration. Now I'm gonna go ahead and move on to your abdomen. Is it okay if I lift the sheets? Is it okay if I lift your gown? Okay, great.
Good morning. Can I please have your date of birth?
So I'm gonna inspect the abdomen from the side. And from the feet of the bed, I'm looking for contour and symmetry and see if I see a AAA pulse. Okay, now I'm gonna go ahead and auscultate the abdomen. Do you have any pain? Okay, then I'm gonna start at the right lower quadrant.
Okay, so first I'm going to start taking your vital signs. It was about 77 beats per minute.
Okay, so all four quadrants are hyperactive vowel sounds. Okay, now I'm gonna go ahead and switch to the bell, and I'm gonna go ahead and listen for any brood. So I'm gonna start at the aorta. And I'm gonna check renal.
I'm gonna check your blood pressure.
Iliac. And femoral. Okay, so there's no bruit, so now I'm gonna go ahead and percuss your abdomen. Do you have any pain? No? Okay, so I'm gonna go ahead and start at the right lower quadrant.
I got 160 over 120. 1 respirations.
Okay. So I'm listening for tympanic or dull sounds. Tympanic is that there's gas or air, and dull sounds is organs or solids. So now I'm gonna go ahead and lightly palpate. Okay, so do you have any pain? Okay, no pain. If he had any pain, I would finish with the quadrant that has pain. So I'm gonna start at the right lower quadrant again. Lightly palpating, moving up to the right upper quadrant. Any pain, Mr. Slade? No? Okay. Now we're at the left upper quadrant. Left lower quadrant. Okay, no pain. Okay, now I'm gonna go ahead and deeply palpate. You let me know if you have any pain, Mr. Slade. Okay. Okay, so I'm done assessing your abdomen. Okay, Mr. Slade, we're all done with the assessment. Do you have any questions for me? No? Okay, well, your cobwheel is going to be here. I'm going to go ahead and raise your side rails. Okay, so you don't have any questions for me, Mr. Slade? Okay. So I'm all done with the assessment. I would throw this in the trash and sanitize my hands. Thank you, Mr. Slade.